Action thoracic film
Action.
series.
A 3-view thoracic spine in the upright position. We'll begin with the AP projection, and I would measure my patient through the mid-sternum, about 20, and I would measure this lateral through the axilla, about 28, and then I would measure for a swimmer's view. Come and raise one of these arms up, that's nice, and raise and measure this straight through the level of C7T1, about 29 or 30, and we're making sure to include this whole area here, okay? So we got our first, we're going to begin with the AP thoracic. It's a 14 by 17 film done at 40 inches, and we're just going to set up our field before we bring our patient in here. And we're going to collimate to less than 17 and just about 8 inches. We want to make sure that we collimate all this, as much lung field out of this film as possible. I placed a 14 by 17 cassette in here. I know that my patient is going to be standing facing this way, so I'm going to put a right marker in a place that I know it won't be in the way. Won't you come along now? Thank you. And here's our patient, and now we don't really have a place to center this ray, so we're going to take the top of the film and put it above the level of C7T1. So it's film to patient, and then central ray to the film. And that assures us of having film underneath this body part when the ray exits. We'll move over to the center. We offer eye shields, and we still have our do not fold apron on. We try not to whack our patient in the face with this. And we're placing this compensation filter right here. Come look at this. We place this in here. We're going to make this shadow, this filter, and this shadow go down to about the sternal angle or so. The purpose of which is to decrease the density in this thinner body part. The anode is in the up position. And we're going to have our patient stay right there. We've already set our machine. Ask her to take a deep breath in. Hold that. Breathe. Don't forget breathe, okay? And then we'll do a lateral. And we'll just have our patient turn to the left side and change our film. We've changed our technique. And here's a nice little pole for her to move her hands out of the way. And we want her to come next to the board, but not lean into it like that, right? Not lean in. So the spine is straight up and down. Spread your feet apart just a little bit. That's nice. And straight. Okay. And could you interdigitate, please? Put your fingers together. Hey. Anyway. I had to throw that in. Alright. So, anyway, look. The spine is in the back, I'll remind you again. And if someone has a lot of lordosis, you could ask them to actually stand up a little straighter here so that the spine isn't going diagonally across the film, but we want this line to be posterior to the mid-axillary line. And this marker is the left marker now, because her left side is next to the film. Yeah. And same breathing instructions. Shouldn't really have to change anything with the height. You can put the breast shield in here if you like, and you should be careful that you don't put them too far in. Make sure that the spine is truly lateral. You can use your hands as a straight edge. Looks good. Once again, take a breath in. Hold it. Breathe. Almost forgot that. Okay, the next view is going to be a swimmer's view. That'd be a swimmer's view. So, first we'll just have our patient stand right where she is, and the swimmer looks at the CT area, so we're going to use C7T1 as our centering point. We're going to use a 10 by 12 film, so we'll collimate inside of that film size. Now we've got 1, the light, 2, the patient, and here comes 3 things centered to one another. This for this swimmer's view. And this is a thick body part requires quite a lot of exposure, so we want to make sure to include these thyroid and breast shields and filters. And now we're going to ask our patient to raise her left arm up as high as possible and hold this in your right hand. So the idea is we're going to project this CT area through these two shoulder girdles. And it's a lateral. You don't want it to be oblique. Lateral. That's what we do. The more she could get her arm up, I know that some patients are incapable of raising their shoulder up any higher, but the closer, the higher up they can get, the more you're spreading these two shoulder girdles apart. But that's nice. There we go. So here's her swimmer's view. It's got a left marker on it because her left side is nearest the film, and the breathing instructions for this one should be suspended expiration, but what we're going to do is have her drop her right shoulder a little bit. That's nice. Now just stop breathing will be sufficient on this, the swimmer's view. That's nice here. Thank you. Those are 3 views of the thoracic spine. You can use the breathing technique with the lateral if you like. You can relax now. The breathing technique, which uses the same MAS value but lowers the MA and uses a long exposure time in order to blur out the ribs and pulmonary structures. But if your patient doesn't understand you, that's not a good idea. So suspended respiration might be better. 3 views of the thoracic spine.